I'm Adam Cohen, the Medical Director of the Emergency Department at Southwestern Vermont Medical Center. I'm here today with a few tips on snow shoveling and safety. Let's start by talking about snow shoveling gear. By far the most common injury we see in the emergency department associated with shoveling snow is the simple slip and fall. Injuries to wrists and ankles are very common. For that reason, I would always recommend having the correct footwear. And there are several attachments you can put on your feet to improve the safety on slick surfaces. Items such as yak tracks. These items provide you with some extra traction when you're walking on ice and shoveling snow. If at any point you feel like your feet or your hands are getting wet, it would be important to stop and make sure that you dry them off before continuing, because wet extremities are much more prone to developing frostbite. By far the most concerning symptom you might experience while shoveling snow is chest pain. Most people who get out there and start shoveling snow might be somewhat out of shape, and shoveling snow is actually a great deal of exertion. You can actually hit your maximum heart rate within just a couple of minutes of starting shoveling snow. If at any point you start noticing any chest pain, pain in your arm, or difficulty breathing, you should stop shoveling right away and contact your physician. A quick word about body mechanics while shoveling snow. It's always important to make sure that you're using proper body mechanics when you're lifting heavy objects repeatedly. And of course, we always try to lift the heaviest load of snow to get our work done as quickly as possible. It's important to keep your hands separated to help minimize the strain on your lower back. It's also important to avoid curving your spine when you bend over to shovel. This multiplies the forces on your lower back, which is most likely to become injured. Instead, bend your knees slightly, and when you're shoveling, either push the snow straight forward, which would be the best, but if you can't, shovel it and twist to the side instead. Never bend all the way over, reach out far in front of you, and try and throw the snow over your head, because that's the most likely way that you'll wind up injuring yourself. In conclusion, make sure you have the proper gear. I would definitely recommend getting some sort of device for your shoes to help prevent falls, since that's the most common injury that we see related to this. If you have any chest pain, any pain in your arm or neck, or any trouble breathing, stop what you're doing right away and call 911 or your private provider, assuming that the pain goes away immediately. And always be careful and watch your body mechanics when you're shoveling, especially if you're not used to exertion. Of course, as a preventive measure, it's always very important to engage in a regular fitness routine so that you can continue doing activities like this even later in life, safely and without having extra exposure to injuries. I'm Adam Cohen from Southwestern Vermont Medical Center Emergency Department, and have a safe time shoveling.